You're tuning in to the O&P Check-in, an SPS podcast. I'm Brendan Erickson, a regional sales manager at SPS. This show brings you the latest happenings in the O&P industry. We're unpacking trends and news from this tight-knit orthotics and prosthetics community. Co-hosting with me today is SPS Sales Account Manager and my good friend, Travis Ricks.
Stoked to be here, Brendan.
Let's get started.
Willowwood has just added a new member to its Meta family of prosthetics feet, introducing the second polycentric ankle design of the line, the brand new MetaFlow, using one-of-a-kind carbon composite C-spring technology with a 14-degree range of motion, 9 degrees of plantar flexion, and 5 degrees of active dorsiflexion. Securely power through any terrain without fear of leaks and energy dampening. Learn more about the MetaFlow at SPS.
We have some exciting news. We are moving our West Distribution Center operations from Reno, Nevada to Fresno, California, beginning in early December. The new 75,000 square foot facility will dramatically increase inventory capacity and SKU count. The site strategically positions us to improve service lead times, allowing our West Coast customers to receive products more quickly and efficiently. Click the link below to learn more. Hello, listeners. Today we have the pleasure of talking with Ashlie White and Olivia Keller from the Amputee Coalition. Ashlie serves as the Chief Strategy and Programs Officer, and Olivia serves as the Public Policy Manager. We're excited to talk with them today about patient advocacy and what they have in store for 2025. Welcome, Ashlie. Welcome, Olivia. We're really excited to have you on the show.
Yeah, thanks, Brendan, for having us.
Yeah, absolutely. Thanks for joining us again. It's always fun to have you back. So how about you kick us off by sharing a little bit about yourselves and how you guys became involved in the O&P profession. Ashlie, you want to kick us off?
Happy to. Ashlie White. I'm the Chief Strategy and Programs Officer at the Amputee Coalition, and I've been working with individuals living with limb loss or limb difference my entire career. In fact, my father's a prosthetist, so I've been around this community my entire life. I used to run our family-owned O&P practice for years, and then when we sold, I transitioned over to the American Orthotic and Prosthetic Association as their health policy director before joining the team here at the Amputee Coalition. So it's great to be on. Olivia?
I'm Olivia Keller. I'm the Public Policy Manager here at the Amputee Coalition. As was mentioned, I've been on staff for about 6 months. So I've been kind of getting my feet wet and learning about our campaigns, starting to get involved with them a little bit. I am actually a person with limb difference, so I was born without arms. So actually, this is kind of really my first dive into anything O&P. My knowledge was more broad across the entire spectrum of disability. So my background is in policy and campaigns.
Wow, between the two of you, there's not much you haven't done.
Thanks for introducing yourself, ladies. Now let's get into some of the deep questions. The U.S. Government Accountability Office, also known as the GAO, recently released a report titled Limb Loss, Rehabilitation Services and Outcomes for Medicare Beneficiaries. The GAO analyzed Medicare claims and beneficiary enrollment data from CMS to determine who in the limb loss community were accessing care, how many were suffering adverse health outcomes, and the challenges patients faced when trying to obtain care. Tell us about what the Amputee Coalition's involvement was in bringing the report to life.
Yeah, I'm happy to take that one, Travis. The Amputee Coalition started the effort to have this data, to get this data from the government way back in the 116th Congress. If you think about Congress is 2 years, every 2 years we go into a new congressional session. The 116th, that we're currently in the 118th Congress, right? So 2 Congresses ago, a piece of legislation called the AAA Study Act was introduced. And in that legislation, the champions who introduced the bill requested that the government look at individuals living with limb loss or those born with limb differences to see what the continuum of care looked like for them, to understand what their experiences were, what type of services they were utilizing, what type of devices they needed, and how that access actually looks from a data perspective. So you fast forward a couple of different Congresses, we got lots of co-sponsors on those bills, but they never passed. And finally, the champions, Senator Tammy Duckworth, Senator Marsha Blackburn, and Senator Jack Casey, as well as Congressman Butterfield, who former Congressman Butterfield, and Congressman Brett Guthrie, they all came together and wrote a bipartisan, bicameral letter requesting GAO to do this study. GAO responded really quickly, actually. Back in 2022, they wrote the members of Congress a letter back saying, yes, we're happy to dive into this issue, but it took a really long time for GAO to actually get the time they needed to be able to do the study.
Yeah, that's great. It's nice to have the kind of support coming from, a bipartisan group like that.
What are your takeaways from the actual report now that we have it?
Some of the things that were, I don't know necessarily surprising, but what we kind of see trending across the spectrum of disability, we also reflected in the report. So for example, racial minorities are disproportionately impacted. We see that across the greater disability community. Rural patients, have higher rates of limb loss. There are more people with disabilities who live in rural communities. Disproportionate rates in the South. The South has higher rate of disability. So we are seeing a lot of that same reflection. One comparative too is that we don't have great statistics when it comes to disability. And that's just not for people with limb difference and limb loss. It's across the board. Most of our analysis on disability is done via estimates. So it was good to actually see some data and some numbers. But these are also only people who are on Medicare. So, we're not getting people who have private insurance, or maybe they're on their state's plan. So there's still a lot that we're missing. And, this is an underrepresentation, but at least we're getting some data on what this one social program reflects. And, it kind of helps establish a trend that we're probably going to see across the board. But it'd still be good to see those numbers.
Olivia, if I could add, one of the pieces of information I think that's missing is that we recognize that these are individuals, Medicare claims for individuals who have had amputations. But unfortunately, we don't know that they're actually capturing the full spectrum of individuals who have aged into Medicare programs, but were actually born with limb difference. So if you think about that population really being missing in this data set, we don't know that to be a fact, but we suspect that it is. But some of those other takeaways that Olivia referenced, the race, rurality, and regionality, the disparities between the different types of populations depending on where they live, I think those things are contributing to what we see are some of the biggest challenges in the orthotic and prosthetic space. And that's for their entire continuum of care. So seeing a statistic like, as an example, for all of Medicare beneficiaries, only 20% of them live in rural America. But for those Medicare beneficiaries who had amputations, 28% of them live in rural America. So we're seeing people lose limbs at a higher rate in rural America. And also they have less access to the healthcare that they need and potentially the prosthetic and orthotic services that they need in rural America. So we know that they're going to be disproportionately impacted. Now you extrapolate those numbers out and you look in the rural South and you see a even larger disproportionately served group of individuals who are Black. All of this data really helps us understand who are the people who are missing the most in their healthcare continuum and what can we do to help make sure that they get adequate healthcare coverage.
Well, it's good to know that you guys are really kind of building that baseline of data to kind of help in the future, right? So it may not be there now, but we'll hopefully get to a point where this information helps us down the line. So with that being said, can you guys give us a little bit more insight on what the Amputee Coalition is doing right now to work on addressing the gaps between connecting the limb loss community to the rehab services and prosthetics care?
One of the things that I think is most important is the work that we're doing on Capitol Hill, right? The things that we are pushing in terms of opportunities with champions who are interested in helping solve some of these problems and areas where it aligns with their legislative agendas. We can get into those offices and we can ask really directly, what could we do? Where are there programmatic opportunities within the current legislative landscape to get something like a funding for coordinated care, providing healthcare navigation and things like that. We've employ a health care navigator at the Amputee Coalition, and she is constantly behind, right? She's always backed up because she gets so many requests in of someone who says, like, I didn't even get a prescription for physical therapy. And it's like, you just had an amputation and you didn't get a prescription for physical therapy. Like, this is not okay. So she calls up the hospital and she's like, hey, so why didn't Miss Mary get a prescription for physical therapy? Then they're like, oops, okay, let's get her a prescription for physical therapy. Some of the time it's just that someone has fallen through the cracks. It's not necessarily that there was like ill intent or, there's bad behavior there. It's just that when you're in a disconnected healthcare environment, there are opportunities for people to fall through the cracks. And we want to make sure that when Congress is looking at what cohesive healthcare needs to look like and how we can improve the quality of the care people are receiving, that they know about this population and they know about the challenges that are experienced by this population. And then they think about us and they think about how they can help add something to their legislative language that might help the limb loss and limb difference community with these challenges that are represented in the data of the study. And then Olivia spends a lot of time working with the Consortium for Constituents with Disabilities. And that organization just hits on every possible type of policy initiative that you could think of across all of the rare disease and disability spaces. And so, Olivia, if you want to talk a little bit about like how we think about, here's a bill that we need to review because it has this one piece in it that might be relevant and might actually help contribute to progress in these areas that we're seeing concerns.
Yeah, definitely. I mean, there obviously is a lot of overlap with other kind of subgroups within the greater disability community, but our community also has its own set of needs. So recently, FEMA, I think, released the extreme heat checklist. And some of the organizations, CCD being one of them, are drafting a letter because, number one, disability wasn't mentioned at all, but we want to make sure that our community's needs are also expressed in that. For example, with me, I was born missing both upper limbs. I don't have the same skin surface area as anyone else does. I'm in Florida. It gets really, really hot, and so my body isn't able to cool itself as efficiently as someone not missing limbs and that has that extra skin surface. So, those are the kinds of things that somebody with a developmental disability may not have to worry about. So, those kinds of needs where people will have issues with temperature control. You see this a lot with people with spinal cord injuries as well, that they sometimes can't sweat. So their body isn't able to cool down and they will overheat in these environments. So it's kind of one of the coalition, letters that we've signed on. We submitted our own comments regarding the enforcement of the Air Carrier Access Act. So our Department of Transportation released provisional rules. So we submitted comments on that about, some of the difficulties our community faces with trying to get on an airplane. And do I wear my prosthesis? Are they going to put it up in the overhead bin if I take it off? And then, how do I get to the restroom? So things like that are kind of concerns for our community specifically. So, looking back towards the GAO report and the issues about, coverage for prosthetic orthotic care as well as rehabilitation, we do have some priorities that we've been working on. A lot of this has been state by state work, although there was a bill filed in this Congress. I don't know that it's going to go anywhere, but it was referred to as the Sport Act. So it would have allowed people receiving services through Veterans Affairs that they can have an adaptive prosthesis for sports and other activities that may not otherwise be deemed a medical necessity. And so therefore insurance typically denies these. So that's where we're seeing this kind of pop up at the federal level. But we do have some state initiatives. So we've been working on insurance parity. So about half the states have insurance parity laws. So that is saying, in their private insurance statutes, or some of them have actually added it to Medicaid and to their state plans as well. But it basically states that prosthetic and orthotic care has to be covered at the same rate that a procedure for someone that wasn't missing a limb would undergo. So if you tear your ACL, yeah, you're going to go to surgery and they're going to repair that, right? You're not going to make you walk around with a knee that won't been insured. So with saying if insurance covers that, then they should also cover these other prosthetics that allow people with amputations to participate in sports and stay active, which is really important. As we saw from the report, there are very high rates of disabilities and peripheral arterial disease that are associated with people losing their limbs. So these aren't people that we want to be sedentary. Like, we want to be them active so they don't risk further amputations. So that connects into that, as well as our So Everybody Can Move initiative. So we have gotten bills passed in 8 states. I'm proud of myself. I think I had them memorized. So Maine, New Hampshire, Maryland, Illinois, Arkansas, Minnesota, Colorado, and New Mexico.
Nice job.
Got it. I have to basically move east to west in my brain across the United States. So the 8 states have these laws. Some of them have put it in both their Medicaid statutes and their statutes for private health plans. Some have even added it to their state health plans. So it really varies state by state and how they've implemented it. But it's the same concept as the Sport Act, only at the state level. So it would allow people to have access to prosthetics for, running blades and swim fins. That insurance would have to pay that the same way that they would pay for your ACL tear surgery.
Yeah, if I could add one additional note, when we're thinking about this report and we want to celebrate the recent CMS change to access to microprocessor technology. So Medicare passed a rule that says that if an individual is a limited community ambulator, they have an activity level assignment of K2 that they will, if they meet medical necessity requirements, will be able to receive a microprocessor, knee unit or ankle unit. The reason that that's so important is because those individuals are at risk of falling. They're actually more at risk of falling than individuals who would have an activity level assignment of K3 or K4. And they can actually utilize the technology that's built into those knees to help stabilize, right? There's stabilizing technology there. And so you think about this great progression in access. But then you look and you see the report says that only 30% of Medicare beneficiaries are receiving prostheses at all. So now we've got this disparity, and it's not 100%. We know 100% of Medicare beneficiaries who lose limbs don't need prostheses, but it's probably closer to 70% that do. And at least at a minimum, they should be receiving a device that allows them to stand at their stove and cook dinner, that allows them to transfer from their wheelchair, that allows them to go to the bathroom without having to transfer over from a wheelchair. We want to make sure that the people who need the access to technology the most have it. And if only 30% of Medicare beneficiaries are receiving prostheses, then we are definitely not meeting that need. So, you get these great advancements in policy, and then you see that, oh, great, the policy's there, but only 30% have access to it. So we know that there's a lot of work to do.
Yeah, and you guys have mentioned, a lot of examples here, but what are some of the advocacy efforts that you guys have coming up in 2025 to further this effort?
Previously, we are working on the So Everybody Can Move initiative. So we have the 28 by 28 campaign, which is, we have the goal of getting So Everybody Can Move legislation passed in 28 states by the 28 Paralympics. We have ambitious goals, but we've already gotten 8. 15 other states have bills that are going to be filed in their upcoming sessions. So we're getting there. So that is definitely a huge initiative that we're spending a lot of time on. We are a national organization. We can't be in all 50 states. So we rely very heavily on our advocates in those states to build those relationships with their lawmakers and, provide them with the resources that they need to kind of develop their expertise in this area. We're there to support them, but we can't be on the ground everywhere. So that is where a lot of our advocacy efforts are being channeled right now. So if people want to get involved, they can go to our website under the What We Do section in the menu. And there's a drop down on advocacy and awareness. So our policy priorities, our federal advocacy, our state advocacy, and information on how to sign up to become an advocate with the Amputee Coalition is on there as well. We have certified lead advocate trainings twice a year. We just wrapped one up a few weeks ago, but we'll be having another one in March. So if people are interested in participating in that, and they should go check out our website.
Yeah, and I just want to give a shout out to Travis. He's one of our co-hosts here for being a state lead. Travis, we're so excited that you're leading the charge for a state group, and we're just thankful that you're going to help us get this passed in another state.
Absolutely. This is something near and dear to my heart. As a lifelong athlete, who ended up becoming an amputee, and in my previous career, seeing so many people get the enjoyment of sport, it is a necessity that everybody has an opportunity to access sport. So the So Everybody Can Move movement is very, very near and dear to my heart. I am leading the charge here in Idaho, and I encourage anybody listening who does not have it in their state to get involved, because it's extremely important for everyone to get access to this equipment. So,
and if I could add another thought bubble for folks, this is the stuff that people just get really tired when they start to hear people talk about appropriations. But one of the pieces of legislation that has to be passed every single year to fund the federal government are those appropriation bills, and the Department of Health and Human Services has to be funded, and the Department of Health and Human Services is where CMS exist. And so how the government funds HHS and CMS, our funding at the Amputee Coalition, part of our funding comes from a cooperative agreement with the Administration for Community Living. The Administration for Community Living was established to make sure that individuals could live healthy lives in their communities instead of being institutionalized. So we have a long history of individuals with disabilities being institutionalized, and the Administration for Community Living exists to make sure that people can continue to live happy, full, complete lives in their communities. That is always a tough part of the federal government to get funded. And so when you hear us talking about appropriations at the Amputee Coalition, one of the efforts that we have coming forward for FY26, FY25 is already underway. We have a continuing resolution right now, meaning that the federal government is not actually funded. We're operating off of a continuing resolution of things that were in place in FY24. So even though we're still in 2024, the federal government's annual year starts on October 1st. So we're looking already forward to FY26, so the fiscal year 26. And what we're hoping to see in that package is something that would give additional funds to care coordination, whether that be through grants into hospital systems to allow for nurse coordinators, as an example, for someone who's had an amputation to be able to make sure that they've got oversight after that amputation. That person's going to make sure that they get a prescription for physical therapy, that they're seeing an occupational therapist, that they get referred out to a physical medicine and rehabilitation doctor. The GAO report actually said that only about 41% of Medicare beneficiaries who have amputations ever see a physiatrist, a physical medicine and rehab doc. And we know that those physician services are really important, right? That's a great care coordinator. And if they don't have access to those individuals, then that's a problem. So it's not just the prosthetic and orthotic referral, it's all of those pieces. But if you imagine they don't get physical therapy, they don't get occupational therapy, they're not seeing a physical medicine or rehab doctor, guess who else they're probably not seeing? They're probably not seeing a prosthetist. And so we really want to make sure that this care coordination is happening. And then on the other side of that, and we only have funding for one healthcare navigator at the Amputee Coalition, what if we had 3? I mean, that's not that much money. What if we just got a little bit of a bump so that we could have 3 healthcare navigators instead of 1? Those people could help, with a person who can't get the right documentation from their doctor to get approved for a prosthesis. We help walk them through that. Our healthcare navigator, Wendy, she's amazing. She's a 20-year now veteran in O&P front office, helping people, just get insurance approvals. And now she works at the Amputee Coalition, and that's what she does. She just helps people figure out and navigate their health care after amputation. So we know that that's a policy that we'll be supporting, and we hope that the community will help us amplify that message.
So I got a question around kind of the stats of the Amputee Coalition, and even So Everybody Can Move movement. I feel like you guys have done a wonderful job. You've set up a great structure for states to kind of adopt a roadmap. And, people like Travis and other state leads are doing that. My question is, how important is it for people that maybe don't have the time to be volunteers or state leads just to spread the word and get this maybe on social media or hang a poster in their patient care facility? And do you have data around that, like X amount of the limb loss and mobility challenged population out there, even though the Amputee Coalition exists, or so anybody can move, movement is in place? And how do we help increase those numbers?
Well, I'm going to take this one because what you're doing right now is such a huge support for us. I mean, thank you so much to SPS and to you, Travis, and to you, Brendan, for supporting our organization and continuously allowing us to amplify our message. You're right. I mean, it takes everyone, no matter if you only have like 5 minutes today to go onto the website and like copy and paste something into a text to a friend, that may not know about it, right? Like anything that you can do to help amplify the message is going to be so important. The other side of that is that you never know who knows someone. In Arkansas, we barely even got our foot game going, like the ground game going, before that bill had passed, because somebody really important somewhere heard about it and they knew the person in the state legislature, and that person made it happen. I mean, and that's very, very different than what happened in New Mexico, where we went there. The Amputee Coalition staff went there twice and did group gatherings. We've approached every state differently because you have to. Everything's different in each state. First and foremost, thank you so much to SPS for having us. Secondly, to all of you listeners, please, please, please share as much as you can that you see coming out of this, so everybody can move movement. And I guarantee you, we're gonna break our own goal. We're gonna hit our own goals long before 2028. I suspect.
I agree with you. When I saw the 2028 number, I know it works in with the Paralympics and everything, but I was like, no, they're gonna do it before then. Absolutely.
Yeah, with the impressive list of state leads already putting this into action, I have no doubt that goal will be reached and surpassed.
Yeah, and I kind of feel like as the momentum grows, it snowballs, and you are going to get some of the amazing social media efforts out there just picking it up and rolling and amplifying it, exponentially. So if you see any of this videos out on social media, listeners, please forward them on, like them, share them, LinkedIn, everything, Instagram. Let's do it. Let's get the word out there.
If you know someone in your state legislature, get them involved.
That's right. If you are in the state legislature, we're talking to you.
That's right. Well, with that being said, I want to just thank Olivia and Ashlie for joining us today. Is there anything else you guys like to share?
Just if people are interested in getting involved, again, they can go to the website. We've got a blog, we have a newsletter, we have a magazine. So there are lots of ways that people can plug in that don't necessarily take a whole lot of time. We have a discussion board that people are very active on and send advice back and forth. So there's a lot of interesting resources there. So please go check it out.
Yeah, and I'll share, we recently brought Nicole Verkylen onto the Amputee Coalition staff. She's been working with us for a couple weeks now, and she joins Olivia and I and Ryan Getty on our government relations and advocacy team. And truly what a talented team it is. I can't say enough how qualified our team is to address kind of any of the policy challenge you might run into out there in the community. So whether you're a person living with limb loss or limb difference, or a clinician providing services or care to individuals living with limb loss or limb difference, if you run into a policy issue, whether that's like a state legislative issue, Medicaid's not covering something, you've got one insurance company that's really being a jerk, please don't hesitate to reach out to our team. We don't know how to fight the things that we don't know about. And I think sometimes there's assumptions that we know we're all knowing and that we know about all the problems out there, but I promise you we don't. So please, please, please let us know when there's something that we need to be paying attention to, so we can put this incredible talent that Olivia and her colleagues to work.
I like it. Call to action. Make them work, guys. Put Olivia to work.
I don't know how I'm feeling about that.
I think you're up for the challenge. Well, cool. Thank you guys so much. This was a fun podcast and always just so beneficial for our listeners to know that they can help. And again, guys, a call to action to any listener out there. Please take the time to spread awareness and spread the word about all of the advocacy efforts that Ashlie and Olivia are spearheading, and the entire So Everybody Can Move movement. We just can't thank you guys enough. Thank you, guys.
Yes, thank you both. Thank you, Amputee Coalition.
Thank you.
Thank you, Brendan. Thank you, Travis.
Thanks, Ed.
Bye.
To learn more about the Amputee Coalition or to connect with Ashlie and Olivia on LinkedIn, follow the links in our show notes.
Thank you for listening to the O&P Check-in, an SPS podcast. We hope you enjoyed the episode, and if you did, be sure to leave a review and subscribe to the show on Spotify, Apple Podcast, or wherever you listen to your podcasts. Have a question or topic suggestion? Email us at spspodcast@spsco.com. See you next time.